Hello class, good day. So I will have these recordings with you because we were not able to meet face to face. So anyway, I will be discussing the blood donation, okay, that is the blood donor screening and selection. And after this discussion, I will also discuss about the hemolytic transfusion reactions. Okay, so let's start with how we are to screen or to select the donors, okay, whenever a patient needs blood or blood components. Okay, anyway, when I say blood, I am only referring to human blood. Okay, and then another thing, when I say blood, that means whole blood. But if I'm gonna say blood components or blood component, that means those are the parts, okay, where we get from the whole blood. Like for example, packed RBCs, platelet concentrate, okay, so blood components. Okay, so anyway, this is like a brochure, okay, on what happens during blood donation. So of course, that's what you can see here. Okay, there is first, okay, a withdrawal or an acquisition, or shall I say, we get blood from a voluntary donor. So I'm emphasizing voluntary because again, remember the Republic Act, okay, Republic Act 7719 and also the Republic Act 1517. Okay, I hope you still remember that in your medtech laws and bioethics. Okay, especially the RA 7719, this one. Okay, so especially the RA 7719, okay, it's the National Blood Services Act of 1994. Remember that Republic Act promotes voluntary blood donation, and to make sure, of course, that we have a sufficient supply of, okay, safe blood. Okay, take note of that one. And also, aside from supplying us with safe blood coming from, again, voluntary donors, okay, that is to regulate the blood banks. So again, that promotes voluntary blood donation. Okay, aside from that, I also mentioned that it is to provide sufficient supply of blood, which is of course safe, and then of course to regulate blood bank. Do not be confused the RA 7719 with RA 1517. This one, RA 1517, because the RA 1517, that is the blood bank law. So specifically, this blood bank law prevents trafficking in human blood. Okay, not only the human blood, the whole blood, but of course its products, its derivatives, or the blood components. So those are the differences between your RA 7719 and RA 1517. So again, RA 7719, that's the National Blood Services Act of 1994, which promotes voluntary blood donation and provides sufficient supply of safe blood, and of course regulate blood banks. For RA 1517, that is again the blood bank law, which prevents trafficking in human blood, and then its products, its derivatives, and any blood components. Okay, so after getting blood from a voluntary blood donor, of course, okay, it is collected in a sterile blood bag. So you have to make sure that you are collecting it aseptically. That's why when you disinfect the arm of the donor, you don't only use alcohol, right? So aside from using the alcohol, you wipe the arm of the donor using iodine or betadine, and you let it stay there for about a minute or more. Okay, and of course, it will be transported to the laboratory, or you can already get blood from the donor in the laboratory. And then of course, it is processed like in a large centrifuged, and okay, it depends on what components the patient is needing. Okay, so like RBCs, plasma, and platelets. So we will be discussing that one when we already discussed the blood components. Okay, another one after that, of course, not only separation, not only processing of a particular component, but again, we need to make sure that the blood is safe for transfusion. Again, that is included in RA 7719. And of course, that will be transfused to the patient who needs the blood. So that's basically the steps of blood donation. So as what you can see here, we medtechs really play a great role, okay, in of course selecting the donor, getting blood from the donor, processing the blood of the donor, and making sure that the blood is transfused safely to the patient. So we have to test not only the vital signs of the donors, but we are also testing, for example, the HIV status of the patient, the Hep B, malaria, syphilis, okay, Hep C. Okay, I have mentioned this to you, I think, in the prelim. So those are the things that we have to consider to make sure that the blood sample, or should I say the blood component, okay, that we are trying to transfuse to the patient is safe, meaning to say free from diseases, okay, free from contamination. That's why we have to process it aseptically. And again, it is in a closed system. Okay, so closed system to make sure that the blood is processed in a sterile manner. So, like for example here, this is a blood bag, and the tube here, which you can see, that is what we call as the pilot tubes. Okay, so if this is the blood bag, okay, and then we have here the pilot tubes, okay, the blood here coming from the donor will be filled in this blood bag, right? So these pilot tubes are sealed also. Sorry for that. Okay, so again, we have here the blood bag. Okay, this is the pilot tube. So it is sealed, okay, or it is tied in some laboratory without having the capacity to have a sealant or to properly seal this one. So they are tying that one into segments, okay, so that when we want to cross-match the blood of the patient, we just get one segment. We will not contaminate the entire blood here. So that is a closed system of how we process the blood components. Okay, another one. So what is a blood donation? So when we say again blood donation, that is voluntary. So it's an act of saving lives. Okay, for individuals who have lost blood caused by accidents or surgery, or in severely anemic patients, or dangerously low platelet counts. Like for example, if the patient has hemophilia or platelet, decreased platelet count, or thrombocytopenia in cases of dengue. So those are the instances where we need to transfuse blood to the patient. Another thing, so these are just examples of the questions that we ask to the blood donors, voluntary blood donors. So, do you suffer from heart diseases, cancer, malignancies, okay, or malignant diseases, TB, sexually transmitted diseases? Of course, because we have to make sure again that the blood is safe, so the donor should not have these diseases. And then, have you taken in past 72 hours like antibodies, steroids, alcohol, rabies vaccine, and vaccination? Because of course, it could affect the blood component that you will transfuse to the patient. Or if, for example, the patient is taking aspirin. So aspirin is a blood thinner. So it will make the patient prone to bleed if ever you have transfused blood which is contaminated with aspirin. And then any abortion in the last 6 months because of the bleeding. And then are you breastfeeding your child? Also at any time taken RH immunoglobulin injection in the last 6 months, any tattoo, acupuncture, or dental extraction. For all you know, all of that, of course, could pose bleeding to the patients, or to the donor. Okay, so blood donor screening, so it ensures that the blood supply, again, keyword here is safe as possible, in which all donors must meet a specific eligibility criteria outlined by the governing agency. So I will let you see the governing agencies later after this slide. And then maximizes safety, again, is emphasized here, of blood donation for the donor and the recipient. Of course, we have to make sure that we are only getting a sufficient amount of blood from the donor, and we are transfusing the required amount to the patient. And of course, making sure that both of them are safe during the entire procedure. So these are the governing agencies. So we have the international and the national governing agency. So we have the AABB. So that's the American Association of Blood Banks. We have the FDA. So that's the U.S. Food and Drug Administration. And then we also have the CAP. So the CAP there, okay, what is the meaning of CAP? So College of American Pathologists. Okay, we have the JCAHO, so Joint Commission on Accreditation on Healthcare Organization. So for the national, of course, this is well known to us, the Philippine National Red Cross, PNRC, the Department of Health, and of course, Philippine Blood Coordination Council. And it's also the Department of Health that regulates the Republic Act, okay, that I have mentioned to you previously, okay? And then I would also want to emphasize that the AABB and the FDA, they are more specifically involved in donor screening. Okay, donor screening regulations. The AABB and the FDA. Okay, again, more specifically involved in donor screening regulations. And the rest of the governing agencies, they are the ones that conduct inspections, like inspections of the hospital blood banks, and then they would review the policies and the procedures for accreditation purposes. So those are the functions of the other governing agencies. Again, the AABB and the FDA are more specifically involved in the donor screening regulations. So what is a donor screening? So a donor screening, as what you can see here, it involves the medical history requirements, the mini physical examinations that includes the vital signs of the patient, and of course the serologic testing that I have mentioned you. Again, what are those serologic testing? So we have the HIV, of course. We have the HCV. Oops, what is that? Okay, we have the HIV. Again, we have the HCV. What else? Syphilis. Then malaria. And what else? Hepa B, HBsAg. Okay, because again, this is an early phase marker for Hepa B. So that's why it's the one commonly tested. Okay, so what are the processes for blood donation? So we have here a table and a flow chart. Of course, number one, there should be a registration. So registration. So what is happening there? The donor provides identification and demographic information. So of course, identification, so meaning to say the donor will bring his or her ID. And take note, those valid IDs are not IDs that are laminated. Okay, like you can paste picture, you can cut the picture, so that can be tampered. So in registration, usually the laboratories would look for a proper identification card with a signature of the donor and of course the face of the donor through a picture. And of course, the donor reads information about blood donation. So if ever the hospital would provide educational material, but usually what you can see in the blood banks are that the donors are already oriented, okay, by the relatives, or maybe they have already experienced donating blood, so they are already aware of the processes. So sometimes we don't really focus on disseminating information like orientation, talking to the donor for a longer period of time, because we have also questionnaires in which we can base our interview to the donor. Okay, and of course, what is more important here is the donor consents to blood donation, because at the end of the questionnaire that you will be asking to the donor, okay, the donor will write his or her name there, and then of course the donor will sign that one. So after the donor passed the registration process, okay, there will be health history and limited physical examination process. So meaning to say, health history questions asked by blood center staff. So usually this health history is already included in, again, the questionnaire. It's the standard questionnaire that we are using in the blood bank. So each blood bank has that questionnaire. Okay, and also, okay, taking on the vital signs like the blood pressure, the pulse, and hemoglobin levels of the donor. So after the donor has passed the physical examination, the vital signs, and of course the interview, okay, there will be already a donation process. Okay, so number 2 is part of the screening. Okay, and of course, part of that screening is to make sure that the donor is properly hydrated before donation and the donor has not, okay, consumed alcoholic drinks before the donation. So you have to cleanse the arm. Again, okay, you have first to cleanse it with alcohol, okay, inward to outward motion. And after that, you have to disinfect it with iodine, and you have to let the iodine stay, okay, in the antecubital fossa of the donor for at least 1 minute. And then of course you you do the blood donation process, and usually it would take 6 to 10 minutes. Okay, and then of course you withdraw the needle, and of course you allow the donor to recover. So after blood donation, you let the donor rest for 15 minutes and you give the donor snacks. So usually you give lugaw or scaldo, or just to make sure that the donor is rehydrated. Okay, and of course will have a source of energy through food after the donation. Okay, and you make sure that the donor rested properly, because some of them after donation would just stand up and then they would just go, and then you will already know that they have already fainted. So you have to let the donor lie down there and rest for 15 minutes before you ask the donor to go. Okay, and then the average donation process takes just under 1 hour. Okay, from registration to the recovery. Okay, next one. So what are the medical history requirements? Okay, so the question here, of course, we have to consider, will a donation of approximately 450 ml whole blood at this time be harmful to the donor? Okay, because sometimes the donor, okay, would just donate 250 ml of the blood. So it depends on the requirement, okay, of the doctor to the patient. However, usually in routine blood donation, we are getting like approximately 450 ml. So why not 500 ml? Because again, the blood bag, okay, I think I have mentioned this to you, the blood bag already contains 63 ml of anticoagulant. Okay, so the blood bag there already has 63 ml of anticoagulant, so it could, okay, hold a maximum volume of, I think, 500 ml. So usually it's just 450 ml or less. And then another thing that you have to consider, could blood drawn from this donor at this time potentially transmit a disease to the recipient? Of course, that's why you are doing the serologic testing. Okay, so that's part of the medical history requirement. And as what I have mentioned, for registration, the blood collection facilities confirms the identity of donors through a photographic identification cards, and make sure that the IDs are considered as valid IDs, like the driver's license or the school ID or the humid ID or passport. Okay, because sometimes, guys, the blood donors, okay, would donate because they need money, especially if there are fixers who would ask them and would pay them. So they would tamper the IDs, or they would just place their faces, okay, their pictures on the IDs, and then they will laminate that one. But the name in the ID is not their name. Okay, so that's why you have to make sure that you always check the IDs of the donor. So these are the list of information in the registration process. Of course, the complete name. When we say complete name, that's first, middle, and last. The date and time of donation. Okay, the address of the donor, the telephone number or mobile number, gender, age, or date of birth, and then of course consent to donate. Again, this is a written consent because, again, as what I have said, the donor has to write his or her name and then to sign this one. So what is the age requirement for a consent to donate? So it's 16 to 18 years old. Okay, especially, okay, you need a consent from their parents. So if the donor is already an adult, then the donor can provide a consent for himself. Okay, but if it is 16 to 18 years old, then it needs a consent from the parents. For the medical history questionnaire, so again, as what I have said, usually in the blood bank, there is a standard questionnaire utilized for blood donation, and some of the blood banks would translate it into local dialect. But you can also see the questionnaires in Harmony. Okay, so the medical history questionnaire, this is an accurate medical history of the donor, which is essential to ensure benefit to the recipient. So the interview should be conducted in a secluded area of the blood center. So why do we have to do this one? Of course, we have to make sure that it is a secluded area, there is a privacy there, because you will be asking personal questions from the donor. Like, you would ask the donor, have you ever had sex with the same sex? Or have you ever had sex with a prostitute, just like that one? Are you pregnant? So those information that you will be asking from the donor are personal, and of course you have to make sure that confidentiality and privacy are observed. That's why we have to do it in an area which is donor is secluded, or it's only you and the donor in that area. Okay, and then another thing, questions are designed so that a simple yes or no can be answered but elaborated if indicated. Okay, and then it should be conducted on the same day of donation. Okay, like when you are getting the vital signs of the donor, like when you are putting temperature, okay, under his, of course, in his underarm. So while waiting for the time, okay, you can ask, sir or ma'am, okay, when was the last time you have donated? Okay, is this your first time to donate? So you interview while doing some physical examination. You can do that one. Okay, or maybe when you are taking blood pressure, for example, so you can interview the donor, okay, to save the time for the entire donation. So this is how the questionnaire would look like. So you can find this in Harmony again. Okay, is the information in the front of this form correct? Okay, are you feeling well today? So the donor would just check that one, and sometimes they could already memorize that one. So yes, yes, no, and sometimes a male donor would place no. For example, there is a question there that would ask, are you pregnant? So sometimes they would check no or yes, but they are male. Okay, so you have to recheck whatever they are ticking or checking in the questionnaire. So do you weigh less than 10 pounds? If yes, list weight. Okay, so because the minimum requirement is 110 pounds. Okay, however, there are instances that we have to compute for the weight of the donor, okay, to the amount of blood that he can donate, okay, based on his weight. Have you donated blood in the last 8 weeks, or a double unit of red cells in the last 16 weeks, or plasma or platelets in the last 48 hours? So 8 weeks, that's presumably, okay, 2 months, right? And then in the past 12 months, have you been under a doctor's care, been pregnant, or had a major illness or surgery? Okay, if yes, what and when? So for example, the donor is a woman, and then she had been pregnant. Okay, so she would check there, and then the medtech would just list down the date, okay, of pregnancy or other surgery there, if ever there is. Do you currently have an infection, or are you taking antibiotics for infection? Okay, because of course, okay, microorganisms can be transmitted through blood. Have you ever had heart problems, lung problems, or bleeding problems? Have you ever had hepatitis? If yes, when? Have you ever had a positive test for HIV or AIDS virus? Have you ever had malaria, babesiosis, or Chagas disease? Okay, because these diseases, of course, can be transmitted, okay, in our blood. And then, have you ever had cancer, including leukemia or lymphoma? And then, have you ever taken any of these drugs like Tegisone, Soriatane, Accutane, Proscar, Propecia, or Avodart? So you will know later what are these medications. In the past 36 hours, have you taken aspirin or anything with aspirin in it? Because as what I have said, aspirin is a blood thinner. Okay? In the past 4 weeks, have you had any vaccinations, shots, or immunizations? In the past 8 weeks, have you received the smallpox vaccine or had close contact with the vaccination site of anyone who has this? Okay. In the past 3 years, have you been out of the US or Canada? If yes, record where and check 1. Okay, so those are just sample questions that you can ask from the donor. Okay, and just like this one also. Okay, and then sometimes you can translate it in local dialect. Okay, or sometimes the medtech can already memorize the question, so the medtech, okay, directly and immediately translate it while reading the English questionnaire. Okay, have you ever taken money or drugs in exchange for sex? So this is already personal. That's why we have to do it in a secluded place again. Have you ever taken street drugs by needles? Have you ever taken clotting factor concentrates for a bleeding problem such as hemophilia, or had sex with someone who has? For men, have you ever had sex with another man? So again, that is what I'm telling you. For women, in the past 12 months, have you had sex with a man who had sex with another man? And then since 1977, have you been in Africa? Were you born in or have you lived in Cameroon, Central African Republic, Chad, Congo, Equatorial Guinea, Gabon, Niger, or Nigeria? Because these are places which again are endemic, okay, with HIV and other blood transmissible diseases. Okay, and of course, other questions that could let us know the history of the patient, and it's up to us, of course, to reject or to defer the donation if ever one of the questions here or more, okay, have been experienced by the blood donor. So it's us medtech who will decide, of course, together with the physical examination and of course the serological testing. So how about for the criteria of the blood donor? So who can donate? Of course, if you have a good health, and again, take note, 16 to 55 years old. Okay, and take note, for 16 and 17, it needs parent consent, especially in the Philippines because 18 is already okay considered as a legal age. So 16 and 17 needs parent consent. Weight at least 110 pounds, BP 90 to 160. That's systolic. 90 or 160. 92, 160 maximum. Diastolic 60 to 100. So 90 over 60 to 160 over 100. So those are the allowable BP for a blood donor. Okay? Pass the physical and health history assessments, of course, of the medtech. So what are the causes for deferral, especially for diseases? So my apologies, but you have to memorize this one because even in the board exam, some of these criteria are asked. Okay? So for permanent, so we have, of course, AIDS, cancer, leukemia, lymphoma, hemophilia, sickle cell anemia, von Willebrand's diseases, thalassemia, Kaposi sarcoma, polycythemia or the polycythemia vera, history of receiving clotting factor concentrates, hepatitis, confirmed positive test for HBsAg, or repeatedly reactive test for anti-HBC because that means you have been infected with Hep B. And then clinical or laboratory evidence of HIV infection, babesiosis, and again, Chagas disease. So all of that which can be transmitted through blood transfusion, and some of that are usually blood diseases, are cause of permanent deferral. So meaning to say, the donor cannot donate. Okay? Next one, for temporary. So like this one, it's only 12 months. After 12 months, the donor can already donate. Donors with history of syphilis or gonorrhea, okay, or treatment of either. So 12 months. Syphilis, gonorrhea, that's sexually transmitted. A history of fever with headache, 1 week prior to donation to consider West Nile virus infection. So that's 28 days. Fever with headache, okay, to consider West Nile virus, 28 days. Donors will receive blood and blood components or other human tissues. So, 12 months. You cannot donate if ever you have been transfused with blood, okay, or other human tissues. Recent surgery that was transfused, 12 months. So you have a surgery and you were transfused with blood. So, still, it's 12 months. Okay? How about for the lifestyle of the donor? So, these are all permanent deferral. So, male donors who had sex with another male since 1977. Had sex with anyone since 1977 who was born or lived in Cameroon again and the places that I have mentioned earlier. Why is it we have this specific date or year? 1977. Because this is the year where there is a widespread use of non-sterile needles in these countries. So, that makes them prone to HIV because of course HIV can be transmitted through needles or sharing of needles or non-sterilized needles. And then donors who spent 6 months or more cumulatively in the UK from 1980 to 1996, and donors who injected bovine insulin manufactured since 1980 from cattle in the UK because they said that this one can also be a source of blood transmissible diseases. Okay, how about for temporary deferral? So if the donor traveled, okay, this usually comes out in the board exam. If it's traveling in malarial endemic country, so it's just 1 month. Okay? And then another one, men or women engage in sex for exchange of money or drugs. So that is since 1977. Again, you know already the reason for this one. So that's still 12 months. Donors who had sex with a past or present IV drug user or any person with hemophilia or related blood disorder. So that's 12 months. Close contact with a person with viral hepatitis, still 12 months. And you have to really memorize this one because sometimes the questions in the board exam, okay, are very confusing. Okay, and then donors exposed to blood or body fluids by an accident, needle stick, or other injury, or person who have received a tattoo. Okay, that's 12 months also. So we have here the 12 months, 12 months, 12 months. Also this one. Also this one. So donors who have been imprisoned for more than 72 hours during the previous 12 months. So 12 months, deferral. Female donors, pregnancy in the past 6 weeks. Okay, so that's again temporary deferral. Okay, so let's go now to the causes of deferral because of drugs. So for permanent deferral, we have here the Tedgison. Okay, that's the trade name for etritinate. This is a trade name, the Tedgison. Okay, this is a medication developed, I think, in 1986, if I'm not mistaken with the date, to treat severe psoriasis. Okay, Tedgison is used to treat severe psoriasis, and the reason why it is permanently deferred if ever the donor is taking this one is because it's teratogenic. Okay, teratogenic. Okay, so how about for the other drugs? Okay, next one, for temporary deferral. Okay, temporary deferral, we have donors taken piroxicam. Okay, we also have aspirin or anything with aspirin. So that's 36 hours. Okay, another one, we have vaccination of live or attenuated bacterial vaccine. So that's 2 weeks. Okay, ingested Accutane or Proscar, that's 1 month. Okay, the Accutane or this Proscar, okay, is a retinoid medication that is used to treat severe acne. Okay, acne. Okay, and then also vaccines for German measles or chickenpox, that's 1 month. And of course, we have dutasteride, okay, or Avodart, that is used to treat benign prostatic hyperplasia, which is also teratogenic. So that is 6 months. Okay, so you really have to memorize the medications because sometimes we don't know what are those that the board of examiners are including, or we don't know, of course, if the medication that the donor is taking is teratogenic. So when we say again teratogenic, so like the Tedgison and the Avodart or the dutasteride, so when we say teratogenic, it can cause congenital disorders in the developing fetus, especially in pregnant women. Okay, another one. How about this one, the CUE? What is a CUE? So confidential unit exclusion. So confidential unit exclusion, that is again the CUE. So what is this one? So this one provides opportunity for those donors who felt pressure to donate in the workplace or the community blood drive to indicate their blood should not be transfused. Like for example, there is a blood drive, okay, in your workplace, and you know, of course, your sexual practices. So you think that it's not safe at the moment for your blood to be transfused. So this is the purpose of CUE. So you can actually state, okay, if your blood can be transfused or cannot be transfused. So you have to inform the blood bank or the blood service facilities that I will donate blood because of course you feel pressure to donate because everybody in your workplace is donating, for example. But then you know your practices, you know yourself, okay? And you are aware that you can transmit okay, blood transmissible diseases to the patient if ever your blood will be used. So you can select no. So you can tick that one, or maybe they can use a barcode. Okay, and then they will discard, of course, the blood that was taken from you. Okay, so that's for the confidential unit exclusion. Okay, let's go now to the physical examination of the donor. So what will be the general appearance of the donor? So general appearance, check for the presence of excessive anxiety, drug or alcohol influence, or nervousness. If ever there are this one, you can observe this from the blood donors, you can defer the donation process. And again, for the weight, okay, what is the minimum weight requirement? That is 110 pounds. Okay, or again, as what I have said, we can compute for the donor's weight. Okay, and of course, the amount of blood that can be taken from that donor. So, for the weight, a maximum of 10.5 ml per kilogram of donor weight for whole blood collection. That is inclusive of pilot tubes for testing. Okay? Next one. How about the volume of whole blood collection? So the donation of a unit of blood should not exceed approximately 10% of the donor's blood volume. Okay, and then a donor weighing at least 110 pounds or 50 kilograms may donate 525 ml of blood. Okay, 525 ml is already including the pilot tube. And then a donor who weighs less than 110 pounds, again, as what I have mentioned, may still donate a volume of blood proportional to his weight. So we have calculations such as this one. So for the amount of blood to be drawn, okay, so what will be the allowable amount? Okay, so the amount of blood to be drawn. So of course, we have to multiply the donor's weight with 450 ml. That's the standard amount of blood that we are taking, I mean, from the donor, and then average divided by 100. So that's the allowable amount. So you compute, okay, the amount of blood to be drawn based on the weight of the donor. So donor's weight times 450 divided by 100. And of course, because you have not taken the maximum amount, okay, of blood from the donor, you have, of course, to adjust the anticoagulant. So from here, from the allowable amount, you multiply it with a standard, which is 14 over 100. So that is where you can get the anticoagulant needed. And of course, okay, from this amount of anticoagulant that you have computed, you have to deduct that from the 63 ml. So I have mentioned that the blood bag usually contains 63 ml of anticoagulant. So that is the amount of anticoagulant that you will remove in order to adjust, okay, for the amount of the blood drawn to the donor. Okay? Next one, how about for the temperature? So the temperature, of course, it's less than or equal to 37.5 degrees Celsius or 99.5 degree Fahrenheit. So 37.5 degrees Celsius or 99.5 degree Fahrenheit. How about the pulse? So for the pulse, it should be 50 to 100 beats per minute. So you have to touch the radial area of the donor, and then you have to time it for 1 minute. And then, of course, the pulse rate must be between 50 to 100. Blood pressures, I have told you earlier. So 90 over 60 and then 160 over 100. Okay? So the systolic pressure of a potential blood donor should be less than or equal to 180. So you can still donate even if it's 180. That's the maximum. So 180 and the diastolic less than or equal to 100. So from 90 over 60 to a maximum of 180 to 100. This is from Harmoning because other books would tell you 160 over 100. Okay, but some of the blood banks would still consider this one. Okay, because remember the reference book, okay, is based from the American people, of course. Next one, hemoglobin. The hemoglobin level of a donor should be greater or equal to 12.5 grams per DL or 125 grams per liter and a hematocrit level of 38% or 0.38 liters per liters. So 12.5 and then 38%. How about skin lesions? Of course, skin lesions might suggest that a donor might have HIV, or the donor might have Kaposi sarcoma, or the donor might have German measles, or any other infections. Okay, evidence of skin lesions, that is multiple puncture marks, is a cause for indefinite deferral, other than skin disorders like poison ivy and other rashes evaluated by blood bank physicians. So like multiple puncture, that could indicate that the donor probably used needles or shared needles from other people. Okay, so these are the summaries of the physiological values of the donors. Again, for general appearance, what are you going to check? So check for the presence of excessive anxiety, drug or alcohol influence, or nervousness. And for the age minimum of 17 years but 16 to 17, they require consent. So there is no upper limit age. So this is the minimum age, but there is no upper limit. Okay, when you say upper limit in allogenic donation, when you say allogenic, meaning to say you get blood, okay, from your relative or from your family member. Because we have also the term autologous donation, like your own blood will be given to you. Okay, how about for the weight? The weight, it's at least 110 pounds or 50 kilograms, but again, it's a maximum of 10.5 ml per kilogram of donor weight for whole blood collection, inclusive of pilot tubes for testing. Hematocrit, greater than or equal to 38%. Hemoglobin, greater than or equal to 12.5. So that is greater than or equal to 12.5 grams per DL, or greater than or equal to 38% for hematocrit. Temperature, again, less than or equal to 37.5 degrees Celsius or 99.5 degrees Fahrenheit. For systolic, okay, just remember, is systolic, it's the one that the number, okay, above. So sky, this one death, okay, or sky and then dirt, okay, 180, then diastolic 100. So that's the maximum. Pulse rate 50 to 100 unless an athlete. Okay? And then another one, we have 12 to 20. Okay? That's the respiratory rate, as long as, of course, the donor is not dyspneic. Okay? There is difficulty in breathing. Okay? How about for this informed consent? So for the informed consent, again, the AABB standards mandates that informed consent of allogenic, autologous, and apheresis donors be obtained before donation, especially in 16 to 17 years old again. So again, allogenic, meaning to say you get blood from your relative, from your family, from your friends, or any other person who is not related to you. Autologous, that's coming from you. Apheresis, meaning to say that's also an allogenic donation but with the use of machine and only getting the component, okay, of interest from the donor. Okay, like you only need platelets, so only the platelets will be harvested from the donor. You only need plasma or you only need RBC, so that's apheresis. And then, donors should be informed about the risk of the procedures and of the test performed to reduce the risk of infectious disease transmission to the recipient. Of course, you have to make sure again that the donation is safe not only to the recipient but of course to the donors. Like after this one, you might feel that you will faint or that you need to rest, etc. Okay? And then donors should be able to ask questions regarding any element of the collection process. Okay? So these are the types of blood donors. So we have allogenic again, a blood donor who is related or unrelated to the recipient. Whereas autologous means one who donates blood for his or her own use, and this is of course safer than allogenic blood because the donor is the patient. And we have 4 types of autologous donation. We have preoperative collection. We also have acute normal volemic hemodilution. We also have intraoperative cell salvage collection, and then post-operative cell salvage collection. So for preoperative, this is done before the procedure. Okay, like for example, before pregnancy, okay, or during pregnancy or in unforeseen complications. Okay, And then for acute normovolemic hemodilution, there is a removal of whole blood from the patient with infusions of crystalloids or colloids before surgical blood loss. Okay? And then for intraoperative, okay, that is collecting and then reinfusing blood lost by a patient during a surgery. So that's why it's intraoperative. And then post-operative, of course, the blood is collected from a drainage tube placed at a surgical site. So that's after the surgery already. Next one, for types of blood donation, so what we have directed, meaning to say, okay, these are having the same requirements as allogenic donors, except that the unit collected is directed toward a specific patient. Like for example, Mr. X is the donor for Miss Y. So that's directed. Okay, because most of the time, guys, it's the folks of the patients who will look for blood donors. So the blood donors already know who the patient is. So that's directed donation. But for pheresis, again, it makes use of an automated cell separator device whose centrifugal force separates blood into components based on differences in density. So like for example, you need only the platelet, so that is what we call as platelet pheresis. You need only the plasma, so that is plasma pheresis. That is pheresis, P-H-E-R-E-S-I-S. Leukopheresis, you only need WBCs. And then double RBC pheresis, you only need RBC. So anything that you don't need, it will be returned to the donor. So this is an apheresis machine. So as what you can see there, okay, there is a donor. And then of course, oops, the donor here, okay, will sit. I think I have experienced this one. So this machine could take about 3 to 4 hours to finish, because of course the donor, okay, so you have here a place where you can hang the blood bag. So for example, you have here the blood bag, and then of course you will have here the tubings, okay, which is connected to this one, okay, which will separate the blood here inside. And of course, there will be a tube connected to the donor. So it's the one that will separate the blood into components, like this is for RBC, this is for white blood cells, and then it will also be connected there. Okay, so there are a lot of tubings, just like this one, as what you can see here. Okay, there are a lot of tubings. This one will separate, okay, the RBC, this one will separate the platelet. So it's like that also. So if you only need a platelet, so this is only the component that will be transfused to the patient, and the rest will be returned to the donor. That's why this procedure would take about 4 hours. Okay, so you can watch a video of this one in YouTube to be familiar of how this is done. Okay, so how about whole blood collection? So once the donor has satisfied the requirements of the screening process, whole blood collection can proceed. So of course, again, there should be donor identification, okay, numeric or alphanumeric system or barcode. Aseptic technique, you have to remember, okay, as what I have said, iodine compound or chlorhexidrine, gluconate, and of course, isopropyl alcohol for donor with allergy to iodine. So you can use any of that, okay, disinfectant or antiseptic, I mean. Okay, and then collection procedure, the donor should never be left unattended, okay, because sometimes the donor will faint in the middle of the collection process. And then low volume unit should not be used for FFP, for it does not contain adequate levels of coagulation factors. Okay, this is one of the considerations that you will have. And then the tubing should be striped to allow proper mixing of anticoagulant, okay, with blood. What is meant by this one? So again, you have here the needle, and then you have here the tubing, and then it's connected, of course, to the blood bag, right? So the blood will flow from the arm of the donor here to the tubing, okay, and then here, okay, until such time you will reach the sufficient amount of blood. So you will scrape the tubing from this point down to the last part of the pilot tube to make sure that the blood that is staying here will be mixed with the anticoagulant contained in the blood bag. So that is what is meant by the tubings should be striped. So we have devices in the laboratory or some clips that we can use to scrape the tubings in order to mix the tubings with, okay, with anticoagulant in the blood bank. Okay, so let's go now to serological testing, which I know for sure you are already familiar with this one. So for serological testing, we have, of course, number 1, ABO grouping or RH typing. So ABO typing must include forward and reverse typing. And what is the rule here? That the blood donor should have the same blood type and RH type with the patient to ensure safety, okay, during donation. And RH typing is done with the anti-D reagent at the immediate spin phase. Okay, and take note, if it is RH negative, you have to test it with weak D. Okay, weak D typing or the DU testing. And blood bags should be labeled with the ABO and RH type of the donor. Of course, you also have to consider the color code of the blood bag, like A blue, B yellow, O white, and then AB pink. I hope you still remember that one. And then antibody screen. AABB standards requires that a donor with a history of pregnancy or transfusion be tested for unexpected antibodies to RBC antigens. Okay, because sometimes there will be an antibody that is directed to the antigen of the patient. Okay? However, there are antibodies which cannot be detected in that instances, so we need to perform the antibody screening using reagent cells. Okay? Next one, HBsAg. So for HBsAg, the test procedure should be approved by the FDA or a documented equivalent method, which includes the RIA, the most common procedure, which is of course the ELISA, and reverse passive heme agglutination. And of course, a supplemental test for HBsAg is the neutralization procedure. Okay, so again, this is a supplemental test for HBsAg in which the donor specimen, okay, again, the donor specimen is reacted with serum known to contain antibody to HBsAg. Again, in neutralization, the donor specimen is reacted with serum that is having a known antibody to HBsAg. So if the reaction is positive, what will happen? It will dissipate upon incubation to about 50%, 50%. Okay, so that's for the neutralization. And of course, all components must be discarded when the results are positive. How about this one, the anti-HBC? Okay, the antibody to the core or interior protein on the hepatitis B has been implicated in hepatitis C disease. Remember, if you have this one, that means you have been infected with Hep B. I hope you still remember your immunology and your virology. Okay, you have discussed this one in that subjects. And remained a requirement of blood donors in the prevention of post-transfusion hepatitis. Okay, and take note, this is the only marker that is positive, especially if the patient is at a window phase of Hep B. Okay, and then we also have of course, the Hep C. Okay, then the NAT. What is this NAT? Nucleic acid amplification test. So screening test is done involving the enzyme immunoassay or the EIA. And in 1999, the nucleic acid amplification test for HCV RNA was implemented as a donor screening assay in which it is able to detect small amounts of viral nucleic acid in blood before antibodies or viral proteins such as HCV core antigen are detectable by current method. So, again, that is detecting the amounts of viral nucleic acids. Even if the donors don't have antibodies yet or viral proteins yet to HCV. Okay, and of course the confirmatory test, that is RIBA. So what is the meaning of RIBA? So that's recombinant, okay, immunoblot test. So RIBA, recombinant immunoblot test, RIBA. And then of course, okay, next one, we have the anti-HIV, very important, and still nucleic acid, okay, nucleic acid test or nucleic acid amplification test. So all blood units must be screened for the presence of anti-HIV 1 and 2 antibody as mandated by AABB standards. If initial screening test is negative, Okay, the unit is suitable for transfusion. But if the test is positive, the test should be repeated in duplicate. Remember what's the screening test for HIV? So the screening test for HIV is ELISA. Okay, so if it's negative again, you have to transfuse. You can transfuse. However, if it is positive, of course, you have to confirm it using the Western blot. Because Western blot is, okay, the Western blot is the confirmatory test for HIV. Okay? Confirmatory test, there it is. Western blot, and you can use also immunofluorescent assay. Okay, how about this one? The West Nile virus RNA. This is not common in the Philippines. So usually the outbreaks of WNV or the West Nile virus in the United States prompted the donor screening for antibodies to West Nile virus. Okay. Next one, the anti-HTLV 1 and 2. So that's human T-cell lymphotrophic virus type 1 or type 2. Okay, so the type 1 is a causative agent of adult T-cell leukemia and has been associated with a neurologic disorder called the HTLV-associated myelopathy. So HTLV. So HTLV2 has shown to have 60% homology with type 1 and prevalent among intravenous drug user in the United States. Okay, a person or persons can contract both viruses, okay, from transfusion via infected lymphocytes. That's why usually the antibodies against this, okay, HTLV, okay, or that virus is tested. Okay, how about this one, syphilis? Remember, if the donor will have this one or tested positive for this one or taking medication to this one, syphilis caused by Treponema pallidum, okay, there is a temporary deferral of 12 months, okay, just like gonorrhea. So the syphilis, for the screening test, we have the RPR and of course the VDRL, okay? And I hope you still remember the principle of this one in your immunology. So cardiolipin-like antibodies have been documented in persons untreated with syphilis. Okay, cardiolipin-like antibodies found in the serum of patients who have been exposed to syphilis. And there have never been any documented cases of transfusion-transmitted syphilis. Since it is being sexually transmitted, it places the donor at a higher risk for possible exposure to hepatitis and HIV. So that is the main reason why syphilis is being checked. Okay, not because there are documented cases of transfusion-related syphilis infection, but because of the sexual practices of the patient, okay, that could pose them to have hepatitis, especially hepatitis B and hepatitis C, and of course, HIV. Okay, so that would be all for this topic for the blood donation process. Okay, thank you very much.